personally really enjoy fast and aggressive ASMR. Maybe not too fast, too aggressive, but I always thought that extremely slow ASMR really doesn't hit the same spot as fast and aggressive. But maybe you guys really enjoy the extremely slow. This kind of ASMR. What do you guys like? I ponder and I wonder and I just want to know what you guys think. Is it fast? Is fast better or is slow better for you? I don't know. Maybe both. Why not both? Yeah. Maybe sometimes you feel like fast ASMR. Maybe sometimes you feel like slow ASMR. Maybe sometimes something in between. It's like Goldilocks. So, I have to ask you guys, what do you guys like? What do you guys enjoy? I definitely like a variety, even though I prefer the ASMR to be a little faster. That's why I always start my videos, and actually throughout my videos, I do things like this. Fast fingers, slow mouth sounds, a combination of both. But what do you guys like? Please let me know. I am genuinely curious. But with that brief discussion aside, what are we going to talk about today? Let's take a look. I got my pocket medicine here today again with me. Let's take a look. I want to talk about acute bacterial meningitis today. Infections of the nervous system. That sounds dangerous, and it is. Alright, so how do we know this is acute bacterial meningitis? Well, let's take a look at the signs and symptoms. The patient will most likely have a fever. That happens in 77% of the patients. Headache, almost definitely. With a high fever, a headache is hard to escape. A patient will also have a stiff neck. So when you try to move their neck, move their head, they resist you. They don't want to move their neck. Why? Because it hurts. There will be some photosensitivity. Okay, so they don't want to, they are aversive to bright lights or just lights in general. Alright, they may have seizures. That is pretty rare, but if you see that, that is also a sign of acute bacterial meningitis. Okay, so these are the symptoms, some of the signs and symptoms. What we call clinical manifestations of the patient. And upon physical exam, when you go to examine the patient, there will be nuchal rigidity, which is just neck stiffness. Fancy name for neck stiffness. Alright, there may be two signs. Okay, first is a Carnic sign, and that is when the patient is lying down in a supine position, and you flex their hip to 90 degrees. Okay, so their knee is pointing straight up, their thigh bone and their femur is pointing straight up. Okay, it's vertical, and then their knees testing you that is a positive Kernig sign, alright? And that suggests acute bacterial meningitis. No good. Alright, and the second is called the Brudzinski sign. Brudzinski sign, what is that? Brudzinski sign. So again, the patient is lying down, supine position. And what we do is we make sure that all their limbs are also supine. So their arms, their legs are flat on the bed. And then we take their head, we take their neck, and then we try to push their chin towards their chest. Try to do that, okay, while they're lying down. And when you do that, if you see the patient lift up their thigh or their knee, oh, that is a positive Brudzinski sign. And that also suggests acute bacterial meningitis. So remember, Kernig sign, that is when you lift up their leg. You, the doctor or the nurse or anyone, lift up their leg, okay? And then they resist you. That's the Kernig sign. And Brudzinski sign, that is when you lift up their head and bend their neck, and the patient lifts up their knee, their leg. That is the Brudzinski sign. So remember, Kernig, you lift up their leg. Brudzinski, you lift up their head. Okay? Kernig, leg. Brudzinski, head. Kernig, leg. Brudzinski, head. Alright. I hope you remember that. And I'm tired of this. I'm gonna put this book away now. Anyways, quick lesson done. Please let me know if you like fast ASMR or slow ASMR. I haven't really tried a slow ASMR video before, but I really should. I want to try it as well. I want to see how it goes. So please let me know if you would like to see